Every minute spent organizing is an hour earned. This is very important and relevant when it comes to organizing your medical records. And this is what we're going to talk about today. Hello and namaste. I'm Dr Sugandhi Unnikrishnan, obstetrician and gynecologist, and welcome to KimKena. Today we're going to understand why is it so important to organize your medical records before you go and meet your doctor. It will help you and your doctor to have a smooth and comfortable consultation and will also help you in time of emergencies. So let's understand a bit more about it. Let me narrate an incident to you that happened many years ago. I was on duty in the labor room and a woman was wheeled in at around 2 a.m. in the morning, bleeding profusely. While my nursing team tried to take care of her and stabilize her, I asked her husband for her medical records. What was given to me was a bulky file, and when I opened it, out fell a pile of bills and other random papers which were not relevant to me at that point of time. It took me around 15 minutes to sift through all those papers to understand what is the recent most investigation, what was most relevant to me. Eventually, the mother and the baby did do well, but this incident made me realize how important it is for a person to organize their medical records so that precious time doesn't get wasted, especially in times of emergencies. Then I realized what's better than a show and tell. So, when I became pregnant, I had made a medical journal or a medical record to keep my investigations and my ultrasounds in order to save time for me and my doctor. And today I decided to demonstrate how I organized my file to you. So let's begin.
This is the folder that I maintained during the time of my pregnancy. Ensure that you label folder with your name, patient ID number, and name of treating doctor. You can maintain a log like this which shows how your blood pressure and weight has been throughout your pregnancy. This will help your doctor to know if your BP or weight is staying in normal limits. You can make something like this called at a glance, where you write down in chronological order the order of date, starting with the earlier investigations at the top and the later ones get added below. You write the date and what test was done, including blood test, ultrasound, vaccination, and any other significant event. The section after this are all the prescriptions given to me by my doctor during the visits I had. So all visits with my doctor I filed as a separate section so that the moment your doctor sees this, they will know that during your last visit what was discussed, what treatment was given, and what more has to be done. Now these folders come with something called separators. It is a simple white separator. You can label them as to what your next section would be. This I've labeled as investigations or blood reports. This section is all my blood reports. The recent ones are filed to the top and older ones to the bottom. It helps your doctor get clarity on how you have been doing health-wise. And the next section I created was for ultrasound. So again a separator, and I've labeled it USG or ultrasonogram. And all the scan reports come in this section. Again, recent ones filed to the top and earlier ones to the bottom. And the last section which I made was bills. Bills are very crucial because we need it for reimbursement and insurance purposes. But ensure they don't come in between your other reports when your file is open, because it eats away a lot of time. Your doctor has to go through multiple bills and pull out reports from it. So please keep your bills filed separately. You can also create a separate section called miscellaneous or extra or something, and there you can file in your dietitian advice, exercise advice, or any materials of that sort which you need and are relevant to you and which you need to refer to it often but are not important during a consultation as such. So this was a quick overview of my pregnancy records folder.
Organizing your reports in this manner will also come in handy when you're trying to plan for a second pregnancy or if you've become pregnant for the second time. Showing these reports to your treating obstetrician will help your doctor to understand how your previous pregnancy journey was, whether you had any kind of complications that required a surgery or a difficult childbirth. So please keep your records safe, especially the discharge summary which is given when you exit the hospital. That one document usually contains most of the information that you've undergone during your treatment time in the hospital. So please keep them safe and it will come in very handy during your next consultation with your obstetrician. So thank you for stopping by and watching this video. I hope it has been useful to you. If you have any kind of queries or inputs, please write to us at ask.kimkena@gmail.com or leave your comments in the comments pane below. Please do like, share and subscribe this video so that I can keep creating more such content for you. Many of you had asked me what the name of our channel Kim Kena means. Kim and Kena are words derived from Sanskrit origin, which means how and why. We believe that in a health journey, when the why is clear, the how becomes easy. And that's what we're trying to do for you. So until I meet you in my next video, stay happy, stay healthy, and see you on the other side.